Are you going through protracted withdrawal symptoms from a psychiatric medication and you're considering reinstating your medication? Then this video is for you. My name is Dr. Reed Dutton. I'm a board-certified adult psychiatrist, and I talk a lot in this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing. And one of the questions that I've gotten multiple times on this app is about whether or not reinstatement makes sense. And of course, I can't give individualized medical advice, and this is not direct medical advice. It's meant to provide you with some knowledge that you can bring so that you guys can discuss further and come up with a treatment plan that works for you. So when I say reinstatement, what I mean is restarting the medication that essentially triggered the withdrawal symptoms. So let's say that you stopped Effexor abruptly and that is what triggered your withdrawal symptoms. So reinstatement would mean restarting the venlafaxine to see if that would help with some of those symptoms. So there's no simple answer for this, and of course it's going to vary depending on each individual and their clinical situation. For many people, reinstatement can be helpful, but I say this with a few caveats. One, the further out from discontinuing the medication you are, the less likely that reinstatement will be helpful. So once you get to like 6 months or more out from stopping the medication, the potential benefits are pretty negligible of restarting that medication. If, however, you're within weeks to maybe a couple of months, there's definitely a potential it could be helpful. The other thing to consider is how sensitized someone's nervous system is, how much they've been kindled, meaning how many times have medications been stopped and started and upped and decreased, which is all going to make their nervous system more sensitized and vulnerable to having a bad reaction upon reinstatement. So if someone has a really sensitized nervous system, then the likelihood of reinstatement having a bad outcome is higher. And so I will certainly be more cautious with this recommendation in those individuals. Regardless of the individual and their vulnerability, if I'm going to start with reinstatement, I'm going to recommend starting a very small dose, like essentially a tester dose, to just see how the system responds. Because you have to keep in mind that if you have a negative response, the worst thing you could do is to stop the medication again, because that's just going to perpetuate kindling and the neurologic injury. So if we start a little dose, they tolerate that well, they're noticing a little bit of symptom improvement, then maybe we'll go up to a little higher dose and essentially might work our way up to the lowest tolerated dose that was helpful for them, but not necessarily. It's always going to be, let's take one step at a time and let's see how that goes. Another reason that I might say let's hold off on trying for reinstatement is if the patient's already noticing some improvement. It may not be helpful or necessary to reinstate their psychiatric medication. If you've had an experience with reinstatement, either positive or negative, I'd love to hear about it. I'm also putting together an email list for those of you who are interested in my content, because I may have future courses or offerings and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email and I'll see you in the next one. To your mental health prescriber.